Imagine a patient struggling to breathe, their chest rising and falling with great effort. In such situations, a ventilator can be a lifesaver. A ventilator is a medical device that helps patients breathe when they can't do it on their own. It's like an external set of lungs, gently pushing air in and out of the lungs, ensuring the body gets the oxygen it needs. Ventilators are commonly used in intensive care units for patients with serious illnesses or injuries. They are crucial for patients who have difficulty breathing due to conditions like pneumonia, lung injury, or during surgery. Ventilators help patients recover by giving their lungs time to heal. The use of ventilators is a common practice in modern medicine, helping countless patients breathe easier and recover from critical conditions. They are sophisticated machines that require careful monitoring and adjustment by trained healthcare professionals. In the following sections, we will delve deeper into the workings of ventilators, explore different ventilator modes, and understand their safe and effective use. To understand how ventilators work, it's helpful to first understand how we breathe naturally. When we inhale, our diaphragm contracts, creating negative pressure in the chest cavity. This negative pressure draws air into the lungs. When we exhale, the diaphragm relaxes, pushing air out. Ventilators mimic this natural process. They are connected to the patient through a tube inserted into the windpipe. The ventilator then pumps air into the lungs, simulating an inhale. When the set pressure or volume is reached, the ventilator stops pushing air, allowing the patient to exhale passively. Ventilators allow healthcare providers to control various aspects of a patient's breathing, including respiratory rate, the number of breaths per minute, tidal volume, the amount of air delivered with each breath, and oxygen concentration, the percentage of oxygen in the air delivered. By carefully adjusting these settings, doctors can ensure that the patient is receiving the right amount of oxygen and ventilation to meet their specific needs. Ventilators come with various modes, each designed to support breathing in different ways. These modes are tailored to meet the specific needs of patients, ensuring that they receive the most appropriate respiratory support. Choosing the right mode depends on the patient's condition and needs. Factors such as the severity of the respiratory issue, the patient's ability to breathe independently, and their overall health status play a crucial role in this decision-making process. Let's look at some common ventilator modes and understand how each one functions to support patients in different scenarios. Controlled mandatory ventilation, or CMV, is one of the fundamental modes used in critical care. In this mode, the ventilator delivers a set number of breaths at a predetermined volume or pressure, regardless of the patient's effort. This ensures that the patient receives consistent and reliable respiratory support. CMV is often used for patients who are unable to breathe on their own, such as those who are heavily sedated or unconscious. It provides complete control over the patient's breathing. Assist control ventilation, or ACV, offers a different approach. ACV combines controlled breaths with assisted breaths, allowing for a more flexible and responsive form of ventilation. The ventilator delivers a set number of breaths, but the patient can trigger additional breaths if they are able. This means that the patient can initiate breaths on their own, which the ventilator will then support. This mode allows for more patient comfort and participation in breathing, making it suitable for patients who are partially able to breathe independently but still require some assistance. Synchronized intermittent mandatory ventilation, or SIMV, is another commonly used mode. SIMV allows the patient to breathe spontaneously between a set number of mandatory breaths. This synchronization helps in maintaining a balance between mechanical support and the patient's own respiratory efforts. This mode helps patients gradually transition from mechanical ventilation to breathing on their own. It is particularly useful during the weaning process, where the goal is to reduce dependence on the ventilator. Pressure support. Ventilation, or PSV, offers yet another approach to respiratory support. In PSV, the ventilator provides a boost of pressure with each breath the patient takes, making it easier for them to breathe. This mode is highly responsive to the patient's own breathing efforts. This mode is often used for weaning patients off the ventilator. By providing just enough support to assist with breathing, it encourages the patient to take more control over their own respiratory function. These are just a few examples of the many ventilator modes available. Each mode has its own specific applications and benefits, tailored to meet the diverse needs of patients. Understanding the different modes and their applications is crucial for providing optimal respiratory support to patients. Healthcare providers must be well versed in these modes to make informed decisions that enhance patient outcomes and ensure effective treatment. Section 4. Setting up a ventilator. A step-by-step guide. Setting up a ventilator is a complex process that requires specialized training and expertise. It involves multiple steps and careful attention to detail to ensure the patient receives the best possible care. However, understanding the basic steps can be helpful. Here's a simplified guide. First, patient assessment. This is a crucial initial step. Before connecting a patient to a ventilator, healthcare providers conduct a thorough assessment of their respiratory status, including their oxygen levels, breathing pattern, and overall condition. This helps in determining the necessity and urgency of ventilation. Next, equipment preparation. The ventilator is checked to ensure it's functioning correctly. This involves a series of tests and calibrations to make sure all components are working as intended. The appropriate size breathing circuit, filter, and humidifier are selected and connected. These components are essential for delivering the right amount of air and maintaining the quality of air the patient breathes. Then, intubation or mask placement. This step is critical for establishing a secure airway. The patient is either intubated, which involves inserting a tube into the windpipe, or fitted with a mask that covers their nose and mouth. The choice between intubation and mask placement depends on the patient's condition and the duration of ventilation required. This creates a secure airway for ventilation, ensuring that the patient receives the necessary support. Following that, ventilator settings. Based on the patient's condition and needs, the healthcare provider sets the ventilator parameters, including the breathing mode, respiratory rate, tidal volume, and oxygen concentration. These settings are crucial for tailoring the ventilation to the patient's specific requirements. Once the ventilator is set up, the patient's vital signs, oxygen levels, and ventilator alarms are closely monitored to ensure the ventilator is working correctly and the patient is responding appropriately. Continuous monitoring allows for timely adjustments and interventions if needed. It's important to note that these are just general steps. Each patient may require a slightly different approach. The specific procedures and protocols may vary depending on the hospital, equipment, and patient's condition. Always follow the guidelines and protocols of your medical facility to ensure the best care for your patients. Section 5. Monitoring and adjusting, keeping a close eye on the patient. After a ventilator is set up, continuous monitoring is crucial. Healthcare professionals keep a close eye on the patient and the ventilator to ensure everything is working as it should. Regular checks are performed to maintain optimal functionality and patient safety. Nurses and respiratory therapists regularly check the patient's vital signs, such as heart rate, blood pressure, and oxygen levels. These vital signs provide critical information about the patient's overall health and how well they are responding to the ventilator support. They also listen to the patient's lungs and observe their chest movements to assess their breathing. This hands-on assessment helps in identifying any abnormalities or changes in the patient's respiratory status. Ventilator monitoring. The ventilator itself provides valuable information. Healthcare providers monitor the ventilator's settings, alarms, and waveforms to ensure the device is functioning correctly and the patient is receiving the intended support. These waveforms can indicate the patient's breathing patterns and any potential issues with the ventilator. Based on the patient's condition and response to the ventilator, adjustments to the settings may be necessary. This could involve fine-tuning various parameters to better match the patient's needs and improve their comfort and safety. This could involve changing the respiratory rate, tidal volume, oxygen concentration, or even the ventilator mode. Each adjustment is carefully considered to ensure it benefits the patient without causing any adverse effects. The goal is to provide the right amount of support while minimizing any potential complications. Balancing ventilator support with patient safety is a delicate task that requires constant vigilance and expertise. Continuous monitoring and timely adjustments are essential for the safe and effective use of ventilators. The collaborative efforts of the healthcare team ensure that the patient receives the best possible care, adapting to their changing needs in real time.